Hello, and welcome to the Nurse Linda webinar. Ask Nurse Linda today. Welcome, friends. It's nice to see those who are returning, and some people are returning that have been gone for a while. It's always interesting to see different names pop up, or people will tell me, "Oh, I listened to you a couple of years ago, and now I have a question, so I'm gonna pop back in." And that's a good thing. I like it. I like the pop in and out because not everybody has an issue that they want to deal with on a monthly basis, but it's nice to be able to chat and to know that you can pop in whenever you want to pop in. So it's been kind of a busy month for me, and so I've done a couple of things that I wanted to share with you. I had a lovely meeting with the PVA Women's Group. Um, the other day we had a online meeting, and what a wonderful group of people. It's always nice to talk to people out in the community. It's one of my favorite things to do. And so we talked about a lot about women's issues. And the Reeve Foundation has a lot of information about women's issues that's available and free to you online. And you'll probably be seeing something come up in the chat pretty soon that about how you can access that information. So I know there's a lot of information about um, changes in women's bodies and planning for the future, family planning, just all kinds of subjects that would be interesting in women, not only in the changes that go on in women's bodies, but also how that's paralysis affects those changes. So it's kind of a cool place to go and visit if you have any questions about what's going on in that area. And then the other thing I did was just this morning, our own Linda Jones from the Reeve Foundation, she's one of our top researchers, and she did a presentation about biomarkers in spinal cord injury for the American Spinal Injury Association. It's called ASIA. They're the ones who make the ASIA scale. If you have a spinal cord injury and they're measuring your level of injury and your motor function and sensory function. This is all the same organization. Now, at the Reeve Foundation, we have a wonderful research program. There's the research side, and then there's the side you're in today, which is education for individuals and families. But our research side is really cool. I always like to give them a shout out. It's run by Dr. Marco Baptista, and both Dr. Baptista and Dr. Jones are just at the top of the game in a spinal cord injury. Now, I always talk about spinal cord injury, and people will sometimes say, well, no, I have a disease. Sometimes people don't think that neurological diseases that affect the spinal cord is spinal cord injury. And in medicine, we don't have a lot of the terminology is from times in the past. And so sometimes it's just sometimes our words are confusing. So sometimes people think, well, spinal cord injury, that's just like if you have an accident, that's an injury. But if you have a disease, the disease can also injure the spine. So when we use the term spinal cord injury, we're talking about all of it. So don't ever think that you're not included. We have a lot more people that are interested in our program here at the Reeve Foundation because there's a lot of information. If somebody has neurological injury like multiple sclerosis, ALS, Guillain-Barré, spina bifida, all these different things. Sometimes people don't think of that as being in the Reeve Foundation, but it all is. We cater to all kinds of paralysis, head injury, stroke, anything that has to do with paralysis. You found the right place. For education, that's this side where we are today. The other side is the research side, and that wonderful things are going on in that. And our leaders, Dr. Batista, and with the help of people like Dr. Jones on his group, oh my gosh, they're just making headways left and right. So it's really wonderful to see. Oh, in the meantime, so on the biomarkers, I wanted to talk just a little bit about that. The presentation was wonderful. It was talking about biomarkers in spinal cord injury, which the two main ones they said were blood markers in the blood and spinal fluid. But then they talked about all the different ways, we get information about our body through x-rays. We get information through our bodies when you wear a smartwatch. And they had that on one of the slides, and I thought, oh yeah, I didn't think about that, but that's so true. It collects your heart rate, it collects your blood pressure. These watches do so many things these days. So it was kind of like they pulled it all together so nicely, so understandably, and it was quite a wonderful thing. But I wanted to just mention biomarkers because it's a new word that people are using, and we hear it a lot these days. It's been around since for years, but people used to never talk about that so much. And so sometimes when people go to the doctor, I'll hear this, and they'll people will tell me, I have biomarkers. I'll be like, okay. And they'll be like, no, I have biomarkers. And I'm like, well, yeah. And so anyway, we'll get talking about it. And sometimes people think a biomarker is like a problem or something that's gone wrong. Like, oh, I have cancer. I have a biomarker. They're different things. So a biomarker is not a disease, but it's a way of checking your disease or checking your injury. It's a way of monitoring what's going on inside your body. Now, we've been checking biomarkers for years, but we don't ever call them biomarkers. But whenever you take your temperature is a biomarker. It's telling you if your temperature is outside the norm of where it should be. If you're checking your blood pressure, the blood pressure is a biomarker. It tells you if your blood pressure is normal or normal for you. Sometimes I know with neurological injuries, sometimes your blood pressure drops, and oftentimes after a few years, it'll go back to where it used to be. But we always like for people with paralysis to check their blood pressure on occasion. It doesn't have to be, like every second, but when you're doing different things, check your blood pressure so you know what your average is. Particularly with spinal cord injury and with some brain injuries, your blood pressure may be low. With brain injury or stroke, your blood pressure might be higher than normal. So if you go to the emergency room, especially if you have low blood pressure, but your blood pressure is reported as normal in the normal range, in the emergency room, they'll say, oh, you're fine. But if you know what your blood pressure is, you can say, no, that's high for me. So you don't want to get put in the, oh, you're just fine, you're perfectly normal blood pressure category when your blood pressure runs something like 90 over 50 as a normal. So if it goes up to 120 over 70, you've got high blood pressure, and you could be having autonomic dysreflexia. So we always like for people to know what their normal blood pressure is, because that helps us predict what we should do with the treatment. It helps with that diagnostic part. When you have an X-ray or an MRI or a scan of your head or your spine or your body in any area, they'll look for changes. They can also do a lot with blood work, and they've done a lot of extensive research in this. So, like, some people are taking some medications. I'm just going to pull one out of the air. There's several, and I can't list them all. But there's some medications that affect your body in different ways. And there's some medications that, like, especially for arthritis. That's why I'm pulling this one out because it's most familiar to me, and you have to take it by an infusion. And just about every hospital has an infusion center because that's been a way of delivering medications, but it's becoming more commonplace where you go to the infusion center and you have an IV placed and you get a medication that goes right into your bloodstream or into a catheter into some part of your body, whatever it needs, however it needs to be delivered. And so some of these medications that are infused that way, and other medications as well, they'll look for biomarkers. So they'll maybe take blood later to see if something has changed in the metabolism of your body. So when you get that report of your blood and it has that whole list of these different things, those are all biomarkers. And so if you have biomarkers, that's normal. Everybody has a biomarker. It's if the biomarker changes, then they start, oh, there might be a problem here. And I know for people who get infusions of some kind, not all of them, but as an example, sometimes their blood has to be checked, and they'll look and see because some of these really high-powered drugs that you get, um, sometimes that will change your biomarker and they'll watch for that. So if your biomarker starts to change, they know they either need to adjust your dose or maybe they need to stop that medication and try something else because it's affecting your body negatively, although it might be helping your problem. It's doing something else in your body. So the more we know about how the body works on this molecular level, how wonderful is that? And so this helps if anybody has neurological disease, they might be checking different biomarkers to see how your disease is progressing. Or if there's a new treatment, they use biomarkers a lot in research. So if you're in a research project and they want to know what's the strength of your arm and they measure with those pressure meters and you squeeze maybe a, a it's like a handle thing and it's got a gauge on the top and it'll give how hard you can squeeze or how much, they'll take the goniometer and they'll measure the how far you can move your joints. Those are all biomarkers. And so they can improve. Or sometimes if you see that they're not doing as well as they used to be doing, you might be ordered some therapy to kind of help you get going with that. So biomarkers are very important. And you've probably had your biomarkers checked if you've ever had your temperature taken or your blood pressure assessed. You've had your biomarkers assessed. So, those biomarkers are working okay. In therapy, somebody's measuring your joint movement. That's a biomarker. So we all have them. But since it's a new word and since it's being put out there and it's being used left and right, I just want to make sure that everybody know that checking your bio it's a good thing. It's just another assessment. It doesn't mean that there's anything wrong with you, but I get a lot of people who say, well, they're checking my biomarkers, so my biomarkers are off. No, they're just checking them. There might not be anything off with them at all. So I just like to make sure that everybody knows that that's what's going on with the biomarker thing. Now, there was somebody who wrote into me, and I just love this question because I love the thought process that went on with this question. So somebody wrote, and privacy, I will not say who they are or anything like that, but if you're listening and you wrote me this question, I really loved it. Because they were watching TV and we all know about the terrible situation with Nancy Guthrie. It's on the news and her disappearance. And one of the things that they talked about was that she required medication and she needed to have this medication. So, and this is the thought process that I love because this person wrote to me and said, I require some medication and I know how important it is that I take my medication and that I take it at a specific time for the problem that this person has. And all of that was true with what they were telling me. Some medications you just have to take it at the exact right time, otherwise things can happen. Now, this was not in this patient scenario, but I'm thinking about, people who have, for example, Parkinson's disease and they take their medication, if they don't take it in the timely fashion, they become stiff and it becomes more difficult for them to move. And so, it's things like that. Some people who have, I don't know, spasticity, it's important that they get their medication on their schedule so that they make pain medicine. That's another one, so that, you can remain pain free. And so, and if you don't get these medications, sometimes, your body will really react negatively towards it. So, anyway, that was the situation. She was like, I don't like to give my personal information out to a lot of people, my health information. Well, guess what? Again, I don't give my personal health information to everybody I pass on the street. I mean, I have some friends, very close friends or family that would know, what I would need. But as far as like, if I just go someplace, I don't walk into a room. Now, before we start our meeting, let me tell you in case this happens, because, it's nobody's business what your personal information is. And so, anyway, she said, what would I do if something happened to me? And say, for instance, she wasn't talking about this horrible situation that family's dealing with, but she's like, what if I fell and hit my head, or what if I just passed out, or what if something happened and I couldn't communicate and say I need my medication? What do I do? Well, there are several things that you can do about this. And this is why I love this question because, it's like really putting together things. And so there are things that you can do. Number one, you can buy those medical alert bracelets, or sometimes they come in necklaces. And so you can have your name is on there and they engrave it and you can wear those. That's one thing. And a lot of people do that and it suffices. Now, with the way the medical system is set up now, um, that we have the electronic medical record, and that works within hospital systems. Some hospital systems will connect with other hospital systems. Emergency rooms, there's like a pass that they have. So if you're out of your system, so you go to a place that has no access to your medical records, the emergency room staff can call to the hospital where you normally go and get your medical records. There's some like emergency process for that. But that doesn't always work. And that, not every place is in that contract to be able to do that. There's always something. But that might be, but if you're not able to communicate and say you were out all by yourself and they don't know who you are, I mean, they maybe could see your driver's license or ID card or something if you had that on you. Let's say you were just going out for a stroll or a wheel down the street, and you thought, well, I don't need to bring my wallet because I'm in my neighborhood, but then you trip and you hit your head, and things happen. There's always something that happens. So, another thing that you can do, pretty much everybody has a cell phone these days. No, not everybody does, but you can always carry an ID card with you in your wallet with your list of medications, your health insurance, a copy of your health insurance card. You should always have these things on you anyway. So if you make that one page thing that I talk about, if you write one page up about yourself, this is my name, this is my address, this is my phone number. Now, don't put out any identifying information like your social security number or anything like that. But, you might have your health card in your wallet or, different things. And then write a list. Here's what I'm allergic to. Here's my medications. These are the times that I take them so that the paramedics, or if you got to the emergency room, they would be able to, have that piece of paper and at least have some idea of what was going on with you. Another thing is if you go on your phone, and each phone is different. So I'm going to give you this vague overline how to do this. On my phone, if I go to the settings section, there's a section in there for emergencies, and I have my name and my medications and my allergies and who to call if I can't respond, who to call, who's my next of kin, who's in charge of me if I can't be in charge of myself. Now, the paramedics and the emergency room, if they find that you have a phone, they know how to get this. Now, if you have your phone set up so it's locked with a passcode, like everybody does, there's an emergency button on your phone that the emergency personnel can press, and this information comes up to the emergency personnel. So even though your phone is locked and they can't get to your messages and your email and all that stuff, they can still see this information, but you have to put it in there. As I say, on my phone, it goes with it goes I go to settings, and then there's this section for emergency. On your phone it might be different. So if you're not sure and you say you have an iPhone, you can type into Google emergency setting on the iPhone, and it tells you how to get on there. They're so wonderful about computer things. Whatever search engine you use, you just type in a question. It's like, oh, well, here's your answer. Kind of love it. So I use that. I find I use that so much, especially when I'm listening to a program, or if I'm at a webinar or a seminar or something and I'm not sure about a word that they use, I can type that in and see what it is that they're talking about. It's kind of handy, very quick and easy. So those are some of the things that you can do on your phone, the bracelets. It's in your electronic record. If you carry a piece of paper with you at all times that kind of introduces yourself to a doctor, those are really wonderful ways of communicating if you can't. And if you are, if you're going to work, maybe you don't want all your workmates to know. Now, if I'm diabetic and I might need this or that. You might not want people to know this kind of thing. I have a heart condition. Our medical information is personal information. You don't need to share it with everyone. And so, but just in case you're out of the in an area where you can't deal with you can't communicate with people for whatever, some odd reason. You have different ways that you can get the medical help that you need if they don't know what it is that you need. So that, it's just some ideas. And if anybody else has some ideas of what they've done, that would be good to know as well. There's a question, and this is on my list of questions. So thank you, reader, for writing in this question. Oh, wait, before I go to the next question, we have an emergency preparedness booklet. And I always like to put that out there. It'll be coming up in the chat box how to get to this information. But there's an emergency preparedness book. I like to say it's one of those books that you should have. You should read it, get the information that's in there, and then I hope you never need to use it because, we don't want you to be stuck in the middle of an emergency. But there's a lot of information in that emergency preparedness book about, oh, and here it is. Thank you, Beth. And there's a lot of information in there that will tell you what to do or how to plan. We've had so many natural disasters, fires and floods and storms, and it's just a good idea to have that information to think it through. How will I use my ventilator if I have no electricity? Well, be sure and call if you're on a ventilator, be sure, or if you have a power wheelchair that has to be plugged in or any kind of equipment that requires electrical services, be sure and let your electrical provider know that this is your situation. They make a note in your file. Who knew they had a file about us? And they don't really have a file about us, but they will note in your address that this is the situation that's going on. And so they will come to your house first if they know that you can't breathe without your ventilator, that somebody's bagging you until they get there. And so they will do that. Also, if you've lost your house key or you can't get into your home for one reason or another, they will come to your house and they'll put a lockbox on your house that only you have the code to and they have the code to. So if you get sick in your house, they don't have to break down your door to come in. They'll be able to come in and help you. So, and that's up to you if you want to do that or if you don't want to do that, that's fine. Nobody's making you do any of these things, but it's just kind of handy to have that information in case something happens, and I fall in and I can't get up and you can't get to the door. And I know I had a medical emergency and they had to break down the front door to get in the house because by then I couldn't get to the door. So, things happen, and spontaneously. So these are all kinds of things to think about. So that emergency preparedness booklet is just wonderful. So the question is, what do you know about the risk of stellate ganglion nerve blocks at C7 for neuropathic pain? Well, I do know some things about this, and I do know that this is something that some people do, nerve blocks, and this one is we kind of have a hierarchy of treatment. So we also have a pain booklet, and that one will be coming up shortly as well. So we have a pain booklet and it goes through the hierarchy of care. So first you start out with, like non-medical measures to help you take care of your pain. And we'll talk about in the pain book, it talks about the different types of pain. You want to be sure and treat the type of pain you have. So, for instance, nerve pain, like this person's asking about nerve pain. If you have nerve pain, you know what nerve pain is. It's a bear. If you haven't had it, but you've ever had a toothache, that's just that pounding, horrible, horrible pain in your tooth, that's nerve pain. So if you don't have neurological disease, but you've had a toothache, you know what nerve pain feels like. It is just treacherous. So there's this nerve book and it goes through the steps. So first people will start out using some non-medical kinds of things, treatments, like distraction, or maybe the use of cold or heat, not hot, but kind of warm, with somebody monitoring the temperature so you don't get burned, monitor the temperature of the cold so you don't get frostbite. But, there's a whole lot of different techniques, mind tricks that you can use to kind of control it. And then if that doesn't work, you can move up the hierarchy, and it usually goes to oral medications. Some people don't like those because they travel throughout the body and they feel like they get brain fog and different things. Some people take them and they have no problem with them whatsoever. And so you can move up the list of those medications, and then they start in with injections. You might move to baclofen pump with some medication in there for pain control. Some people use it just for pain control with pain medicine that's delivered directly to bathe the spinal cord to help calm that all down. Some people use it baclofen and pain medicine in the pump combination. So there's all different kinds of things. Now they're talking about a nerve block. And so a lot of times people do this, and it's an injection that affects the nerve that's coming out of the spinal cord. So it's not into the spinal cord, it's the nerve that's coming out of that area. And so this is kind of a higher level form of treatment. But a lot of people do this. And so at that C7 area, you need to look for some things like, you want to, first of all, you want to get somebody who's done this before and really knows what they're doing. A lot of times they'll do it in interventional radiology so they can see where the nerve is so they don't damage that nerve while they're doing it. They just want the nerve to relax and maybe get a little sleepy, so that that pain message is not transferred. So there's some effects that can happen. Now, it might take 7 to 10 days for this nerve block to work. So don't think, some people will go in, they'll have the nerve block and they'll be like, oh yeah, this is better. Some people won't get results for 7 to 10 days. So if you think, no, it's not worked, it will. You got to give it time. Pain treatment always takes a lot of time. It never is like, oh, I'm all better now. It takes time. Problems you might have droopy eyes, red eyes, you might get hoarse, you might have difficulty swallowing. It depends on exactly where they give the injection. So these are kind of things that can happen. Now, kind of some complications that can happen that are sort of out there because you're going to go to a place, hopefully, where they're doing this in a very clean environment. You do have to worry about, could you get an infection? Well, anybody can get an infection at any time. But, you want somebody who's taking precautions, that's cleaning the skin. Skin's got a lot of bacteria on it just in general. It just lives there. It's just the way it is. It's not harmful bacteria, but it's got some, but it doesn't need to be inside your body. So that, you want to make sure they clean the area well. They could hit that nerve, causing some nerve injury. Sometimes you can get a pneumothorax if they hit it in the wrong spot and it goes into your lungs, or, you know, different things. So you really want somebody who knows what they're doing. You want to be sure and disclose to people what medications you're on and all the medications you're on, because it could affect the treatment. So if you don't mention that you happen to be on blood thinners, you could bleed in that site with the injection, and blood could go to the site that they're injecting. And so you could have, a little clot there, or you know, once they pull the needle out, it could bleed and bleed and bleed. There are all kinds of things because they go in kind of deep. So you want to disclose blood thinners. You want to disclose all the medications you're on, whether they're prescribed or whether they're not, because sometimes supplements have that same bleeding problem. They can affect your coagulation. So maybe you might bleed extra heavy after this injection. And I mean, these are kind of things that are not real common, but they're things to think about. So even if it's not something prescribed, you still want to be sure and tell them what medications, because you don't want your supplements to interfere with this injection or counteract it or make it overwork, which would make things worse for your breathing or droopy eye, or if you had those kind of problems afterwards. Most people don't get those. Most people go, they have these and it's just fine. I sound like I'm scaring, but you did ask for what I know about this. So I'll tell you everything I know about it. Let's see, what are some of the other things I wanted to mention about this? Um, oh, the other thing is if you use any over-the-counter drugs, what we used to call street drugs, like if you go to the CBD shop, if you use any kind of lotions on your body. So some people, well, it's bothering me in that area. I'm going to put a little hemp cream on there. You might need to be off of that before you get this. Now, I don't know you and I don't know, your whole situation. I'm just trying to think of everything I know. Sometimes they won't want body lotions, just like plain old body lotion to keep your skin moist. A lot of people need to use that to keep their skin moist because, they're not producing sweat, which is keeping their skin moist. So you get a lot of dry skin with neurological injury. And so sometimes they'll say, don't put that on for 24 hours before or something. So be sure and disclose anything you are putting into your body, inhaling in your body, in your eyes, eye drops, um, anything that you're rubbing on your body, anything you're inserting into your body, anything that you're doing. And, just be sure and tell them that you're on any allergies that you have. There might be something in the procedure, I don't know, maybe that you're allergic to. Maybe you're thinking about the injection and maybe they're going to numb the area or numb the surface of the skin before they put the injection in, and maybe you're allergic to that stuff. So be sure and just tell them everything about you. Now, you'll think, okay, well, it's all in my medical record. And so, they'll look at that. Well, yeah, they will look at that, but maybe it didn't make an impression on them that you're taking XYZ or something. So just be sure and have that conversation. Be sure and mention anything that you've ever had any allergic reaction to. It could be food, it could be I have hay fever, it could be I very susceptible to poison ivy. What does that have to do with the nerve block? Well, frankly, nothing, but it's just good to know because there might be some chemical in the poison ivy that they think, oh, then we shouldn't be using this particular product on you if you're susceptible. Now that's a way far out thing. But sometimes things that you think, oh, they don't need to know that. Yes, they need to know everything. Let them be the determinant of what they need to know and what they don't need to know. So a lot of people have these nerve blocks. They find that they work really well. Now, there are some alternates if you don't want to go in, if you're kind of worried about this. I'm kind of worried about this kind of a risky procedure because it is riskier than other procedures. I'm as far as like getting that neuropathic pain. You might want to try one of these new devices where they use an electrical stimulation. They put an electrode over the area and that breaks the pain signal. It's not enough electricity to give you movement like all the new movement devices that we have and are coming out now. It's not enough to give you movement, but it's enough to break the pain. The frequencies are different. And so that might be something that you also might want to think about as an alternative treatment. If you're really worried about having that injection, you might want to try that. It's non-invasive. You get that electrical stimulation, but it's not like, that it's not going to go in and damage that nerve like a needle could. But more than likely, that won't happen because the person knows what they're doing. They're not just shooting it in there and hoping for the best. They know what they're doing. They know where the nerve is. If they want to do it under interventional radiology and have some kind of mild X-ray going through your body so they can see exactly where they're injecting. Oh, I don't want to put this in your lung. Oh, I don't want to put this in a big blood vessel. I don't want to put this in the nerve. So that those kind of things help. So those are some of the questions. I hope I haven't overwhelmed you or scared you about the nerve block because people do have them and they are very successful. It's kind of a last ditch measure where people are like, nothing's working. So sometimes, we all get to that point where nothing seems to be working. You know how that goes. So, anyway, those are what I know about that. And I see you're online. So if you have a follow-up question, oh, yes. Okay. Oh, oh, thanks. This is very helpful. Okay, I love it. I appreciate that. Okay. And then, oh, we are at the last stitch effort. That breaks my heart. So, hopefully this will be now. If you haven't tried that nerve stimulator, you might want to try that. Maybe you've tried it already, but I speak in generalities, so I just put out everything that I can think of. Um, Somebody had written in and wanted, they have several secondary and tertiary questions. Secondary conditions are things that happen because you have paralysis. So, like you get a contracture, or you're not up and able to be mobile. And so you're not exercising your legs and you're not doing your stretching exercises. You're more vulnerable to diabetes type 2. So you really need to exercise your legs. If you can't get up and walk around, you really need to get exercising, either move your legs or have someone move your legs for you. And you know what? That's a heavy, hard job. So that can be not too enticing for people to do. And people say, oh, but it's so boring while somebody's exercising me and I'm just laying there and so boring. And so they'll listen to a podcast or music or they'll be doing something else. But it's such a waste of time. It is time consuming. It's heavy, hard work. There's kind of a way that will help, not completely, but it will help if you get a standing frame. Most are covered now if you talk to your healthcare professional. Some of them have arm gliders, like skiing, shoo, shoo, shoo. And as you move your arms, it moves your legs. Of course, if you can't move your arms, then you can't really do the leg movement thing. Or somebody could do the arm gliders for you and move that, and that gives you some motion in your legs. But the standing frame gives you puts your body weight through your bones. Now there is a statistic out there that's like within 2 to 4 weeks, if you're not standing on your bones, you're starting to develop osteoporosis. You're becoming osteoporotic. You might have osteopenia, which is right before osteoporosis. So given that fact, it's worth your time and thought. Even if you have a high level injury or um, these things come with safety straps. So you get into the device, you're seated, you transfer into the device, and there's standing wheelchairs now. They're not as easy to get as a standing frame, but standing wheelchairs, you can stand up and put that same weight through your body. But even if you don't have control of your upper body, there's straps, they go around your thighs, they strap in your hips. You can get one that if you need a strap around your chest. There's even a little halo you can get for your head that will hold your body up so that you're standing in the upright position, which is very nice. Um, so, in thinking about the secondary and tertiary conditions, there's so many that I can't go through all of them now, but the Reeve page, and it will come up here pretty soon. It will there's a place on the Reeve website where they have all the secondary conditions that can develop from paralysis. And so it's all the treatments it is, why it happens, it's everything. It's just lovely. So I'm going to recommend that you go there. Um, so that's at least an opportunity because there's so many. If you have any particular ones you want to talk about, I'd be happy to talk about those too. So here's another question. I had a reaction to an antibiotic be given through an IV because they were given too quickly. I broke out in a rash and got super itchy. Yes, some people can take some antibiotics if they're given very slowly. They might have been giving that antibiotic in its normal pace, but you needed it slowly. So you might have like some kind of little reaction to that medication, but if given slowly enough, your body doesn't pick up on it. So it can, yeah, you need to make sure that your medication is given to you in the correct way for you. So if you have that piece of information, I got this particular antibiotic, other antibiotics might not do to it. So I specify this particular antibiotic, it was given too quickly and I broke out in a rash because they're going to declare that you're allergic to that, even if you can take it superficially. Now, sometimes you might have some infection, and the one that broke you out in the rash is the antibiotic that you need. And so if they have that piece of information, they will ask you, are you willing to try this particular antibiotic? And I know I had that situation with my own mom. She was allergic to something, but she needed that particular antibiotic. And so they said, would you be willing to try it, but at a much slower rate of speed? And she did, and she was fine, and she got better. So there you have it. Now, that might not be the same situation for everybody. But anyway, that's a good way to find out about those things. So we've got a bunch of questions coming in here. Um, Oh, so here's a person that did an electrical stimulation trial, and it was really helpful. And so they're proceeding to the subdermal implant. So great. This is a different electrical stimulator. It's a saluda, sorry. And so now it's one that gets implanted. So there are electrical stimulations that work on the skin. There are some that get implanted in your body. There are some that can be implanted on the peripheral outside of your spinal cord. But they're kind of switching away from that right now. Some people, it will still be in the toolkit. It will still be an option that's available, but right now, people are having such success with the ARC EX by Onward Medical, and there are other companies that are making these, so the price will become more competitive. Right now, on the last time I looked at their webpage, and I haven't looked for several months, but last time I looked on their webpage, the ARC EX spine stimulator is was pricing out at 51,000, which sounds like a tremendous amount of money, but if you have insurance, um, that would not be the price that you would pay. You would pay whatever your insurance doesn't pay. So, there's different options for that. 51,000 in the scale of medical stuff is not that expensive. 51,000 coming out of my pocketbook would break the bank. So I understand. But in the world of medicine, that's like dirt cheap. Anybody who bought a power chair lately, you know what I'm talking about. All this stuff is very expensive. So that's a good thing. I wanted to talk a little bit about the ARC-EX because I talk about it periodically. And that is a thing. It's a electrical stimulator that goes on patches over your spinal column, either up by the neck, or they have a version that's down lower in the lumbar. And I'm not sure if that one is out for public consumption now or not. But the people who have done the ones up in the hands, so there are people that have been in the clinical trials doing this. Now, some people think this is just everything, and some people are not at all interested in it, and that's okay. But it's important that you have this knowledge that it's an option. If you don't want to try it right now, that's fine. A lot of people, they have their universal cuff, they have good hand function, they're good. That's great. Their life, they don't want to upend their life and do something different. This device will not make you the way you were before you became paralyzed. It will help improve your function. So some of the data that has come in is that 90% of subjects experience gains in function or strength, 90%. Now, that's not everybody. That's not 100%. So it might be the thing for you and it might not. And 87% noted that it improved their quality of life. The person that they did this who had paralysis the longest was 34 years with paralysis, and then they tried this device. So it's available to a lot of people. Now it's been out for a while now, but there's a lot of education that has to go on with educating physicians how to order it, who should have it, who do they think would benefit from it? Because not everybody is going to. Some people are going to be able to use it, and some people are not going to be able to use it. Then they need to know, how to dial it up to what you need, the stimulation that you need. Then the therapists need to know how to do the therapy with it. So they've recently gotten approval that you can take this device home now, so you don't have to use it just in, when it was first approved, it was just for in the clinical setting, so that you would learn to use it, learn these different functions, but then you'd go home, you wouldn't have it. Now you can take it home, so that's good. And they've got 60 centers now in around the United States. So you would have to go to their onwardmedical.com website to see if it's in your area. But if it's not in your area, it will be coming to your area. They're putting it out all throughout the United States, all throughout Europe, and I'm sure it will be going to other countries. And as I say, there are other companies that are making this device. It's different, but the same kind of thought process. So I like to bring that up because so many people are so very interested in this that it's just become kind of a fascination for a lot of people. And so let's see, what are some of the other questions here that we're dealing with? Something has, I hit something on my screen. I can't see me anymore, but that's okay. I don't need to see me. I'd really like to see all you guys, but anyway, it doesn't work that way. Okay, here's from an old friend. I have a secondary shoulder injury due to wheelchair use. I've since gotten a companion device for my wheelchair. Have you seen this kind of injuries heal or get better after your 50s when you are a woman? That's a very interesting question. So, secondary shoulder injuries come from overuse of the shoulder. We have hip joints and we have shoulder joints. Our arms and legs are kind of the same bony structure. um, we have ball joints at our hips and shoulders, and then we have different joints that are at our knees and elbows, and then toe joints and the ankle and wrist joints, and they kind of are they mimic each other, which is a very cool thing. So, what's going on with this is that even though even though we rely on our shoulders when you have paralysis to move yourself about, and you rely on your shoulders, they're not as strong as your hip joints. They're just not as big. They're not made to carry the body weight through the shoulders. So people get shoulder injuries. Now, if there's some kind of a device that you're using to help with a wheelchair, that's very helpful. If you can get a transfer device to take, because you're lifting your body weight when you're transferring. And so if you can get a transfer device, now it used to be that, people we would tell people, well, you just got to transfer yourself and, that's the way it is. Sometimes even a sliding board, they don't use those so much. We used to use them a whole lot before, but they don't use them as much. People pick up their body, but if you can slide your body from wheelchair to bed or chair to chair or wherever you're moving, those are very helpful, and those are the simplest and the cheapest. But now the thought has changed because of people are living longer with paralysis, because they're getting these secondary injuries. Insurance is being a lot more um, generous with getting transfer equipment as you're aging with paralysis. Because what they're seeing is, a lot of people, maybe they have an attendant and the attendant's gotten older and they can't do the transferring anymore. So the person needs a transfer device. The device always goes to the patient, even if an attendant is using it for transferring. It always belongs to the patient. Insurance will not pay. If you're an attendant, they will not give you a transfer device to use on somebody else. It's the patient who has to have the transferring device. And so a lot of people are using those devices. So, can that shoulder injury heal? Yes. If you take off some of the workload, it can heal up. As long as you're trying to transfer yourself and lifting your body, it's probably not going to heal up. But if you can get any kind of transfer device, maybe a Hoyer lift. Some people have the different devices that are like a mechanical device on the ceiling that will whisk people around their house. So they're kind of cool because you can load yourself if you're have arm function. You can load yourself in the device to get up in the morning. You can whiz into the bathroom, almost like a zip line, but it's attached to your ceiling, and you can position yourself over the toilet, do whatever you need to do there, then go straight into your shower, all in the same little device, and then finally end up getting dressed, and then getting yourself into your wheelchair for the day. So, people set them up in different ways so that they can, do different things around the house. So there's all different kinds of transferring devices. If you have some standing ability, there's some swivel boards that you can stand on. If you can't stand, you can't use the swivel board unless somebody is lifting you and transferring you. But yes, you can, but you need to unload the load off your shoulders. So that's the thing. Oh, she does not have osteoporosis, and that's good because you're doing something that's keeping you from getting that. So that's a good thing. Same person. So standing frame is, even if you don't have it, standing frame is good. And it's kind of cool too, because you're standing up. Some of them have standing frames, they have a little wheels, like mini wheels up at shoulder height. So you can wheel yourself around and be standing while you're doing it. So like some people will do their standing frame while they're cooking dinner because they're moving around in the kitchen, but they're standing and it takes some time to get the meal pulled together. So, people do all different kinds of ways. Sometimes people watch their favorite program on TV. Sometimes people do their crafts while they're standing. They have some kind of little reward for themselves for doing their standing, which is always important. I think giving yourself rewards is really kind of nice things. I like to give myself a little reward now and again. Any thoughts on neuropathy creams? Mama Bear magnesium cream. I really don't trust reviews because they can be faked. Yes, they can. And thank you for asking this question. So, there are these creams for neuropathy, and it's lotions, ointments, balms that you can put on your skin. Okay, so I heard about these, and they work for some people and they don't work for other people. You might buy one brand and it works for you, and then you might say, "Well, I'm going to try this other brand," and it no longer it doesn't work for you. So there's all different kinds of combinations. And so I decided one day, I thought, oh, hey, I'm going to look up neuropathy cream. I just put a nerve pain cream in there to see. I was on Amazon. I look up a lot of stuff just to see what's what in there. They must have had over 100 different kinds. So how do you know which one works for you? Well, you don't. You just have to try them until you find one. Not everybody's neuropathic pain is going to be the same. For some people, they have neuropathic pain because they have diabetes. Some people have neuropathic pain because they have a spinal cord injury or head injury. Now, if you have um, the neuropathy creams work more on the nerves that are bothering you in your peripheral nervous system. So those are the nerves that are outside the brain and the spinal cord. If the pain is coming because you've had a spinal cord tumor, you've had a brain tumor, you've had some kind of the injury to your spinal cord, and the nerve pain is stemming from your spinal cord, the neuropathy ointments might not work for that. This works for people who have nerve ending pain. So, like usually in their feet or maybe in their fingertips, it usually starts there. So you can try these different creams, but there's not really, it's like people will ask me the same thing about pressure injuries and which is the best cream to use on a pressure injury. And it's individual to the person. And I hate that answer because I know people want an answer. There's all these creams out there. I can't spend hundreds of dollars till I find the right one and then maybe never do find the right one. So it's really a matter of trial and effort, though, on these creams to find out which one is going to work with you. Now, I know a lot of people that have tried the neuropathy cream for, and they've had a spinal cord injury and it's just enough to set it off. Or it might be one of the things that they're using in their treatment plan. If you get that pain booklet, there's all kinds of treatments, like I was outlining before, starting with the very beginning kinds of things and then working your way up to some of these more elaborate kinds of treatments. So there's all different kinds of treatments. So some people will use medication, maybe some neuropathy cream, and distraction, keeping their mind busy. Because, if you're just sitting there thinking, oh, this really hurts, this really hurts. If you get engrossed in a really good movie, or if you get your brain occupied on you're playing some kind of a game, or you're doing some kind of, homework, or you're reading a book, sometimes your mind can get into that and it can kind of forget about the pain for a little while. So sometimes it's a whole combination. So it really works a lot by trial and effort, unfortunately. So I would love to give you the name of a cream that really worked, but, you know, if you go to Walmart, CVS, Walgreens, um, if you go to pharmacies, different stores like that, and you go to the foot section, they'll have some neuropathy creams in there. That some of them are not too expensive, $7 or $8. Some of them are like 20, 30, $50 for, and you're going to spend $50 on something that you're not sure if it works or not. I doubt that I would do that. I'd start out with a cheap one maybe first and then see if it works a little bit, and then maybe a more expensive one would work better. They all have different constellations of things. You might chat with your doctor to see if they have a lot of patients with neuropathy, and what are they using. You might ask other people if you belong to any kind of group. There are online forums where you can ask different people, what kind of neuropathy pain have you tried? Did it work? So if you can get the voice of people who are actually doing this, you're going to have a lot better than if you read some of the reviews. You're exactly right. And they could be thousands of reviews because, tell your friends to write, we really want to sell this product. So, the pros and cons to using non-invasive ventilators. Well, when you use a regular mechanical ventilator, you have to have the tracheostomy tube, so you have opening in your skin, and the tube, if you have any kind of neck function, and you're trying to turn your head, it's a harder plastic thing. Sometimes it's metal and it doesn't move where your head wants to, so it kind of pulls. You have to wear that string around your throat. They can be coughed out, and so those are some of the problem if you have an invasive ventilator. If you have the non-invasive ventilator, and these really they were around before, but they became prominent in COVID, and you would see people with just like some nasal prongs, and they would be tightly fastened around the face. So there's a little thing you have to wear instead of down here. You have to wear a little strap to keep it up, and there would be really tightly fastened, and it would blow the uh, the oxygen into your lungs. There are some that are like a little tent that goes over your head. If you're claustrophobic, you might not like that. Once you get it on and you think, oh, yeah, this is helping me breathe, you might end up liking it. So, those are some of the things. So, it depends on what your condition is, and it depends on the strength. The ventilator with the tracheostomy is the most powerful, but some of the other ones work very well for some people. So, check with your doctor. You might want to see a doctor who orders mechanical ventilation so that you can see what's going on with that. So that's good. Is the RX still only for arm and hand function? I think so. I haven't heard too much, although I did see sample picture online where they showed the one that's for the lower body, which helps more with bowel, bladder, gives you some hip function. It was hopeful that it would be enough function that people would be able to stand. I don't think that that goal was gained, but these devices, if you get it for the neck or if you get it for the lower body, and other companies, it might be another company that will come out with the lower body. And I apologize to ArcEX if they've released their lower body one, because I did see a picture of it online, so I thought, oh, maybe that is out, but I haven't seen that notice yet. But it helps. Not only does it help with your functional movement, but it also helps with things going on inside your body. So they've done studies for the one that's placed higher. People have better breathing capacity. It might affect their heart function, which can help affect their blood pressure. I know that they are doing a study now for one that's they're hoping it's just in clinical. It's just a study. I don't even know if it's in clinical trials or they're getting ready to do the clinical trials. It's just to help with autonomic dysreflexia. Would that not be a gift? For people who have really problems. You put a little tape disc on your back of your neck. Now there's a little power box that goes with it, but then you don't have AD anymore. Well, that would be just very, very nice. So, this stuff is moving at lightning pace. It used to be even just 20 years ago, 10 years ago, there would be a big announcement on TV. Oh, this came out and oh, this is so fabulous. And oh, this is going to be the answer. And everybody's like gung ho only to be let down because, oh, well, we have to do a lot more research. And, it doesn't often work there that way. Um, Oh, how do I know where that neuropathic pain is coming from, if it's from the peripherals or from the spine? You kind of sort of know by if you had a spinal cord injury or if you have a neurological disease. If you had trauma to your spine or brain, it's probably central. If you have neurological disease and it's the peripheral nerves that are being affected by your disease, then it's going to be more peripheral. If you're not sure, you can check with your doctor. And as I say, they might know that there's something that everybody is doing that, might be just the ticket that you might want to know about. Um, let's see. I think that is all. Oh, you know what? Well, we're talking about these electronic devices and we were talking about ventilation. I do want to mention at the Cleveland Clinic, uh, they have a diaphragm nerve stimulator. It is an implant. It's kind of put in with minimal invasive surgery. So it's not like a huge, huge surgery, but it's still surgery, and that has its own risk that everybody has. But if you have paralysis, it's a little more riskier, but surgery is a little more riskier. But they have this diaphragmatic pacemaker where they put electrodes on the diaphragm, and then some wires come out through your skin, and then or maybe the wires I think now are inside, and then the electrodes go over this on the skin where it's implanted in your body. I'm going to have to check on that because I'm not quite sure where we are with that. But anyway, this can has given people a lot more function in their breathing. It is available. It is on the market. You can go to your local thoracic surgeon, and even if they haven't put one in, they can call the Cleveland Clinic, talk to the doctor who does this particular surgery, and he will teach them how to do it. He told me it's the same technique that thoracic surgeons do with other procedures that they do. So it's not something that is new to them. It's just something that has a little different twist because they're leaving these electrodes on your diaphragm. So they're placing something instead of just going in and repairing something or, doing something, but it's the same surgery. So if you call the Cleveland Clinic, they can tell you all about the device. It has helped so many people get off the ventilator. Some people don't get off the ventilator, but they can get off of it during the day and then just use the ventilator at night. So, people have, different responses as with everything. So that's also quite, and I always love to talk about that because that has helped so many people with uh, ventilators. People who have ventilators have a higher risk of infection in their lungs, higher risk of pneumonia. And then this diaphragmatic pacemaker, you can look up diaphragmatic pacemaker and it will all come up on the internet as well. So that's another thing to think about. So with that, it's at the top of the hour. It's time for me to sign off. But boy, we had a productive day today. And thank you for these wonderful questions because they've really been some different questions that a lot of people are really interested in hearing about. So I thank you very much. And the second Wednesday in March, we have a professional webinar. We're going to talk about relationships. So I'll see you either then, the second Wednesday in March at 2 o'clock, or I'll see you the last Wednesday in March at 2 o'clock for the next Ask Nurse Linda. Thanks for coming.